presentation. We're Group 12. I'm Benjamin Hassett.
I'm Ben Grondin.
I'm Fernando Salazar.
And I'm Daniela Barber.
And our topic is ACL reconstruction and regeneration. ACL tears are one of the most prevalent orthopedic injuries and account for over 200,000 tears over a year, 100,000 of those requiring surgery to correct them. Annually, this costs about $2 billion, making it a very large industry. Of those that are most affected, the 14 to 45-year-olds tend to be them just due to their more active lifestyle. And of that, men make up the most proportion of those injured. However, women are 2 to 8 times more likely to experience a tear.
Continuing with the clinical need, the most common ACL repair approach is the ACL reconstruction. They use autografts and allografts, and both of these have limitations. The autografts have extra recovery time due to the graft harvesting, either from the patellar tendon or the hamstring. The allografts are taken from cadavers, and the patients are more prone to have infections and reject the graft. Here you can see the ACL ligament reconstruction that have the 2 tunnel positions in the femur and tibia. And due to the angle, it creates a controversy because after 10 to 15 years from the replacement, there's presence of osteoarthritis. Also for the autografts from the patellar tendon, there's an increased probability of patellar tendinitis. And this is a highly invasive procedure with multiple wound sites that result in a slow recovery from 6 to 7 months.
So the product we're suggesting is a polymer fixation device that will allow rather than removing the 2 ends of the ACL, will allow you to reattach them and provide natural regeneration recovery for the tendon. It's made of a PCl, PLA, PLGA copolymer due to its biocompatibility and its controllable degradation rate. To fix the tendon in place, we have a micro peg and hold design. So when the 2 ends are brought together, they click into place and they're able to withstand the forces that the knee will encounter. In the center is a collagen scaffold, directional to help with the directionality of the ligament that's being regenerated. And it's seated with insulin-like growth factor and transforming growth factor. The micropins function like hundreds to thousands of small sutures, holding them in place and providing directional stresses during recovery. Due to the growth factors on the interior scaffold, it encourages the migration of fibroblasts to the wound site that will start creating their own extracellular matrix for regeneration. The ends of the ligament are held in position using an arthroscope with attached forceps, and then a second surgeon would apply the clip. For this method, the surgeon does need to assess if the ACL is in a condition in which this method can be used, as not all tears are applicable for our method.
Alright, so some benefits for this device is that it's a single operation which will cause no further damage to the ligament, and there's no need to use autografts or allografts. It will be a stable and predicted growth due to the growth factors being used and the directional stresses. And there's no cell culture time, so this would help us not waste time. The cost for this is a difficult fabrication and a complex design, plus a larger incision site. It does not work for avulsion fracture or a complete separation of the ligament, and it creates a polymer degradation buildup, which may be toxic to the patient. And the rehab time is the same as allograft and autograft procedure.
Current competitions for autografts, there's bone patellar tendon bone autograft, the hamstring autograft from the semitendinosus and gracilis tendon. Allografts are from cadavers, and it's Achilles, quadriceps, and hamstring tendons that are mostly used. There are also synthetic applications, but they're not grossly commonly used due to mechanical failure. The most common one is LARS, ligament augmentation and reconstruction system. There are also regenerative applications. One of them is Regenhance ACL Repair from Boston Children's Hospital. We can see an image over here. They use a sponge to connect, they use sutures to connect it in a sponge filled with the patient's blood to enhance regeneration of the ACL. There's a stem cell treatment with blood platelets from Regenix. That's an injection directly to the ACL, and which also enhances ACL reconstruction, and it's also from the patient's platelets.
And there's our citations.
Thank you.